2004 hallmarks the 100-year anniversary of the Department of Urology at Jefferson Medical College. As one of the oldest urology departments in the country, Jefferson has always been on the frontier of urology. In February 1902, a group of 8 New York Genitourinary Society members formed the American Urological Association, or AUA, just 2 years before our department was formally established. The AUA Centennial in 2002 indicates how closely our growth has been associated with the development of the field of urology. In 1874, William Home Van Buren and Edward L. Keyes published their practical treatise on the surgical diseases of the genitourinary organs. This influenced more surgeons of their day to become interested in specializing in diseases of the genitourinary system. Catheters have been around since antiquity, and our own distinguished Philadelphian, Benjamin Franklin, is well known for the silver coil catheter he designed for his brother in 1752. By the end of the 19th century, catheters hidden in hats, walking sticks, and umbrellas were the accessories for men with prostate-related urinary obstruction. It was in this era, in 1894, that Jefferson Hospital established a Department of Genitourinary Diseases and appointed Dr. Orville Horwitz as clinical professor of genitourinary diseases. The department flourished with surgical activity and became one of the largest departments in the hospital. 10 years later, on May 4, 1904, a formal Department of Genitourinary Diseases was established in the medical college, and Dr. Horwitz became the first chairman. Dr. Hiram Rittenhouse Lew was under the personal tutelage of Professor Samuel D. Gross. During his era, the suprapubic prostatectomy was popularized for the treatment of benign prostatic hyperplasia. In 1929, excretory urography, or IVP, was developed as a less invasive method of imaging the kidney for stones and tumors. This was also the antibiotic era. Although Fleming had discovered penicillin in 1928, sulfanilamide became the first synthetic antibacterial to be produced in 1932, and synthetic penicillin was produced in 1942. Dr. Thomas Cook Stellwagen introduced the renal pedicle tourniquet, which was applied around the renal artery and vein after a partial nephrectomy to control delayed bleeding for this high-risk procedure. His tenure as chairman lasted until 1935, the same year that Frederick Foley introduced the self-retaining balloon catheter, now simply referred to as a Foley. At the Brady Institute of Johns Hopkins University, Dr. David M. Davis completed a urological residency and co-authored with Dr. Hugh Hampton Young a urological treatise entitled Practice of Urology. He served as associate editor of the Journal of Urology at that time of his inception in 1917. Dr. Davis became known throughout the world and was well known for the Davis intubated ureterotomy. Shortly after his arrival, the Department of Genitourinary Diseases changed its name to the Department of Urology.
My most memorable experience was my first contact in the Department of Urology. I was a medical student, finishing my first year, walking through the halls going to a class, and somebody said to me, "How would you like to help out with an operation?" And I thought that was better than going to physiology class, so I went up, and Dr. David M. Davis, who I'd never met before but had heard of, the great urologist, and he was doing a dismembered pyeloplasty, a repeat, very difficult operation, and there was no one assigned in the resident staff to help him. He was working with a nurse. He put me to work holding a retractor. I watched him work, and And then as we were closing, it was very impressive, it took hours. But as we were closing, he was putting through and through sutures in because it was a repeat operation. And I broke the through and through needle. It's a long needle, and he let that go the first time. And he dug it out and we put it in again. And I broke it again, trying to pull it through. And he said to me, "Have you ever been in the operating room before?" And I said, "No, sir. You see, I was a freshman medical student walking to class." He was very kind. And then it became a teaching experience, and he was as gentle as could be, and it was a great experience.
In 1946, Dr. George Strong co-authored the staging of bladder cancer with Dr. Hugh Jewett at Johns Hopkins shortly before his arrival here at Thomas Jefferson that same year.
The most memorable experience at Jefferson was working with Dr. George Strong, who was a true virtuoso in that he was a solo practitioner who did it all himself, and he was a brilliant diagnostician and a wonderful surgeon.
In 1948, Dr. Willard Drake, here at Jefferson, developed the Drake Uroflow meter, which was one of the first devices used for uroflow assessments. In 1946, a professorship in urology was established as a memorial to Nathan Lewis Hatfield, and Dr. Davis was its first recipient. David M. Davis was also the first recipient of the Hugh Hampton Young Award to the American Urological Association in 1969. To honor his contribution to the Department of Urology, the annual David M. Davis Visiting Professorship was established in 1981. During Dr. Theodore Fetter's chairmanship, modern urology was developing rapidly. The 1950s brought along ultrasound technology, and fiber optics developed in 1954 brought along better cystoscopes. Dr. Paul Zimskind's research accomplishments in urodynamics excelled him to international recognition. He assumed the chairmanship of the Department of Urology as one of the youngest men to reach the status of executive faculty at the age of 36.
Paul was a charming, kind, wonderful man. He had a doctorate in ureteral physiology, which he obtained in 1964. And in 1965, he spent a year in Sweden under Dr. Kiel, the number one ureteral physiologist in the world. Paul brought these research techniques back to Jefferson, and at Jefferson, over the years, he expanded on the physiology of the ureter and gave us much of the body of the knowledge that we use today.
Dr. Zimskind is honored with the annual Zimskind Award that was created in 1979 by the Society of Urodynamics and Female Urology to a urologist who has significantly contributed to the advancement of knowledge in female urology and urodynamics. In 1976, Dr. Jules H. Bogave became acting chairman of the department until the appointment of Dr. Grant Mulholland as the Nathan Lewis Hatfield Professor and Chairman of the department in 1977. When Dr. Mulholland initially became chairman, the Department of Urology was almost entirely composed of volunteer faculty who were quite talented and had large practices.
We took the department to another level with multi-specialties that were very competitive and contemporary. This was sorely needed in that institution and many other institutions around the country because urology was going through a tremendous revolution at that time, and most departments needed to build and have depth with their clinical subspecialties.
When Dr. Mulholland came, over the succeeding 25 years or so, little by little he built the department into a nationally and internationally known department. And slowly the days of private urology went by the wayside, and we ended up with a tremendous, strong academic department.
Dr. Demetrius Bagley joined the department in 1983, the year the extracorporeal shockwave lithotripsy, or SWAL, for non-invasive stone treatment was developed.
This was brand new. It was just developing, and I was very fortunate to convince Demetrius Bagley to come on. And we certainly, or he certainly was one of the prime movers in this country and around the world in that specialty. And I think that was a great accomplishment at our institution.
Dr. Bagley is one of the world's leaders in endourology, ureteroscopy, and the treatment of stone disease, and has achieved both national and international recognition for the department.
When I got started at Jefferson, I walked onto the campus in 1983. That was the same day that Demetrius Bagley walked in, and there was a whole brand new era of urology going on. That was just the dawning of real implants for penile prostheses. Dr. Bagley wrote the Centennial article with Huffman and Lyon on endourology, which got that entire field going.
Infertility and sexual dysfunction, urologic oncology, laparoscopic surgery, neurourology, and female urology are all fields that are now well represented by the academic faculty. With the addition of new specialties and more practicing urologists, we eventually expanded into an 11,500 square foot office on campus. An important recent department milestone included the amalgamation of all urologists at Thomas Jefferson and Methodist hospitals, which established a large diversified department offering both primary and tertiary urologic care. In August 2002, Dr. Leonard G. Gamella was appointed chairman of the Department of Urology. Since his tenure as chairman, he has worked to continue the long legacy of excellence in urology at the Thomas Jefferson University. The Department of Urology established resident training in 1939 under Dr. David M. Davis's leadership. World War II caused a delay in increasing the number of residents, but a second was created in 1946 and a third in 1947. In 1948, an arrangement with Professor John H. Gibbon Jr. provided a year of training in general surgery before beginning 3 years in the urology residency. Since that time, over 110 residents and fellows have completed training at Jefferson, while over 200 Jefferson Medical College graduates have entered the urological field. With all urological specialties represented by the academic faculty, the residency program at Thomas Jefferson provides excellent training in all areas of urology. Our relationship with the Pediatric Urology Department at A.I. DuPont Hospital for Children in Wilmington, Delaware, provides extensive clinical pediatric urology experience. The experience at the Wilmington VA Medical Center, as well as the experience in a private hospital setting at Bryn Mawr Hospital, adds to the variety and breadth of urological exposure of our residents, who have achieved success in both academic and private practice careers.
We're a leader in urology because we have excellent programs in endourology and laparoscopy. And as a resident, I'm doing things here with Dr. Bagley and Dr. Gamella that other attending urologists at outside institutions don't want to do. And you know, with their guidance and some training, I can do things that I know other urologists who have finished their training still can't do.
I think that we're going to be known for is continuing with that tradition, but carrying it to the next level, which is making it very contemporary. Certainly at the cutting edge, literally, of surgery and urology.
Jefferson truly is a leader in urology.
Jefferson Urology celebrates its centennial. It's been a wonderful opportunity for us to go back and really study the details of the first 100 years of the Department of Urology, and it's given us a great insight on where the entire field of urology has gone. We really learned a lot about where urology started, particularly here in Philadelphia. We learned about how residency programs in urology actually began around World War II and expanded greatly in the late 1940s and the early 1950s. Some of the biggest names in urology have worked here at Jefferson and either stayed here at Jefferson or gone on to outstanding academic careers in other locations. But I think we have a very, very proud heritage and legacy of educating both students and residents, and now a whole generation of fellows in the field of urology, and we're very proud to have done that here at Jefferson.
The history of urology and our department are closely aligned. The vision of the Department of Urology as we proceed to the next 100 years is to continue to be a center of excellence. We will stay on the forefront in the treatment of urological diseases and in the advancement of the field of urology. We continue our commitment to training future generations of urologists as we provide compassionate and quality care to our patients.